Welcome back to Learn with Dhanya. And happy that I'm meeting you all again with a new video. Today it is again the continuation of HCC frequently asked questions part 3. And hope so you have seen part 1 and part 2 HCC interview question. If you have not watched it, I have added a playlist for it, so please go through it, so you will be finding it useful if you are looking for HCC job change. Okay, so without wasting time, directly we can enter into part 3 interview questions. So in part 3, the first question is, tell me few examples for non-acceptable provider. Non-acceptable provider, for example, medical assistant, physical assistant, those who are not considered as acceptable providers, so these people will be falling under non-acceptable provider in HCC. So the next question is, tell me few examples for acceptable documentation. For acceptable documentation, history and physical examination, progress note, discharge summary. These things are very much important and they are considered as acceptable documentation. And then the next question, what is SOAP? SOAP format, this is frequently asked question. So I'll explain it. You can go through that page also. SOAP. S refers to subjective. O refers to objective. A refers to assessment and P refers to plan or proposed treatment. Okay, so S means subjective. Subjective means the purpose of visit, that is called as subjective. Objective means the observation what the doctor is making out, that is called as objective. And third one is assessment. Based on the patient condition, what all test or everything, like to find out the exact diagnosis, what all things they are doing, that is fall under assessment. And finally P refers to the plan or a proposed treatment. It will be completely based on the radiographs or medication prescribed, surgical procedures, those things will be falling under proposed treatment or plan. And next one is, what is CHEDDAR format? CHEDDAR, CHEDDAR format. So C refers to chief complaints. Chief complaint means the presenting problem, like with what the patient is coming to the hospital and telling the doctor, that is called as chief complaints. And second one is H. H is for history. History which falls for social history, physical history, like what and all history content, family history, personal history, everything, whatever the patient is telling, that is H. And third one is E. E falls for examination. Examination, the complete body system, what all system the doctor is examining, that falls for E. And next one is D, detailed of problems and complaints. And the next D is for drug and dosage. And A is for assessment. And R is for return visit information. So this is all about CHEDDAR. This is also an important question. Make a note of it and keep. And next one is, what is the meaning of high RAF? High RAF, risk adjustment factor. Risk adjustment factor score reflects the most complicated patient. As we seen in part 1, it is clearly explained, like a patient with highest risk score is considered as a complicated patient. The highest consumption of resources as well as highest complexity of care will be needed for that patient, and the risk adjustment factor will be calculated every year for each patient. And next one is, what is RADV? RADV. RADV is referred as risk adjustment data validation, which is a process of verifying diagnosis code submitted for payment. Okay, in order to avoid the errors, they will be doing this risk adjustment data validation. And next question, will you quote from family history condition? No. We will be considering only personal history as well as social history. Family history is not coded. Can you resolve status condition? Can you quote the resolved status conditions? No, we won't. And then what is tamper? TAMPER, tamper. Tamper is, T is for treatment, A is for assessment, M is for monitor or medicated plan, P is for plan, and E is for evaluation, and R is for referral. This is all about tamper. And next one is, how many charts have you coded, or how many charts will you code in your company? So this is a question. So based on that, you can tell about your target and what project you have worked for and what was the target for that. And apart from the target, like how much more you can do it. It shows like how efficient or how useful you will be for the company. So in order to prove that, you have to tell about your targets as well as your incentives and everything, like how much effective you are for the company. So this is all about total HCC interview questions. Hope so you have find it useful, and if you haven't subscribed my channel, please do subscribe it, and if you find it really useful, please do share it with your friends also. And then if you have really liked it, please don't forget to put a like, comment, as well as if you have any other queries or questions, please do share it as your comment. And thank you so much for your valuable time. We'll catch soon in next video. Thank you. Bye bye. Take care. Have a great day.